Can we all see the slides now?
Yes.
Okay, wonderful. All right, I will turn it over to Dr. Jackson Best to begin. And you just tell me when you need me to advance. Thanks.
Okay, I'll send you some, or I'll give you some cues when it's going to be moving through the slides. So thank you everybody for attending the rounds today. Special thanks to Natasha for agreeing to do this presentation, and thank you so much to Russ this afternoon for all of the troubleshooting and just helping us through this system-wide outage that's preventing us from seeing you and from you seeing us, but we're happy that we're able to be creative and move through this. So I'm gonna have to give Russ some cues to go between slides. So we should be on that main slide where it is introducing the topic or the title of our presentation today, which is Score Systems Mapping Active Spaces in Hamilton's Riverdale Neighborhood. Moving on to the next slide, I introduced myself earlier, and so did Natasha. I'm an assistant professor at HEI in the Faculty of Health Sciences, but I'm also the project manager of a project called Pathways to Care that I've been working on since 2018. And the reason that I thought that was important is because that was really the first time that I've engaged in systems mapping. We designed a systems map that focused on services that are mental health focused, and our primary focus is Black children, youth, and their families, and also service providers, to help them or enable them to find services that are mental health focused in their neighborhoods, which are either Black-led or mainstream. So that was the first systems map that I was able to supervise and be a part of. And so working on this systems map with SCORE and with Natasha has been a really great kind of secondary experience. Natasha, I don't know if you wanted to say anything else about your background or anything else in terms of your the work that you're doing.
So aside from the short summary earlier, yes, so I'm a recent graduate from the Global Health Department as well. I completed my master's earlier this year. My project was on surgical referrals and basically elucidating barriers and facilitators to care. And so that's something that we are focusing on quite a bit in this project, as well as we are looking at the barriers and facilitators to accessible, healthy, active living in outdoor spaces in particular. And so that's something that's been very helpful in this project. And so aside from that, I think that, yeah, we can move on to the next slide.
All right, thank you, Natasha. So before I get into some information about the SCORE project, just to reiterate what Natasha started on, SCORE is really working to develop interventions that are optimizing healthy active living and preventing obesity and type 2 diabetes in children between the ages of 5 to 11 and new immigrant and refugee families that are living in the neighborhood of Riverdale. But I wanted to immigrant children and low-income children who are living in North America, and some of the different factors that are impacting their higher levels of obesity and type 2 diabetes, and really to set the groundwork for the importance of this project and the significance of the map. So when we look at the data, it shows that about 32.2% of immigrant children had low-income status, which is an important comparison to make when we look at the 15.4% of non-immigrant children in the 2016 Canadian census. And when we looked at newcomer children from single-parent families or families with more than one child, and amongst immigrants who come from countries that are not part of the OECD, that those numbers were further exacerbated, or the issues were further exacerbated due to these underlying and other factors that impact children's lives. And when we look at emerging research, we see that it's suggesting that children who are not white and who are newcomer children to North America and to Europe are actually facing greater burdens of conditions like obesity and complications related to type 2 diabetes in comparison to white European origin populations. So there's an example in a study that was done with children that were aged 4 to 12 in Australia, and it found that those children that came from low and middle income countries actually have higher obesity rates than non-migrants and immigrants from high income countries. So there's a really stark difference and disparity that's existing there. There's another study that compared the prevalence of obesity amongst North African children in their native countries, and it compared them to children who had migrated to Europe, and it found that immigrant children, and especially immigrant girl children, had a greater prevalence of obesity. So those numbers look like 25.6% versus 30.4%. And when we think about higher obesity rates and higher levels of type 2 diabetes prevalence amongst immigrant children in high-income countries, the concern really is that those conditions are risk factors for later negative health implications like the development of cardiovascular and other chronic diseases. So it's really an issue of the lifespan and ensuring that children are being set up in a good way, rather than being set up to essentially have these long-lasting and potentially deadly conditions throughout their lives. So Russ, we can move on to the next slide, which is about the background. So I'm not from Hamilton, I live in Toronto, but I've learned a lot about the Riverdale neighborhood in Hamilton from this project, from the SCORE project. So the Riverdale neighborhood is in the east end of the city of Hamilton, Ontario. It consists of a huge or very large proportion of visible minority people and immigrant communities, and the area can be divided into census tracts that make Riverdale East and Riverdale West. So 47% of the population of Riverdale East and 36% of the population of Riverdale West are composed of immigrant populations. Of the populations of Riverdale East and West, about 43 and 26% of those populations respectively identify as being from a visible minority community. And the largest ethnic groups, other than people of European origin, are people that are of Asian origin, which is about 32% and 17% respectively for the Riverdale East and West communities. And when we're thinking about the material circumstances of community members in the Riverdale neighborhood, there is a significantly higher material deprivation when it is compared to other other areas in the city of Hamilton. So when we look at communities like the Westdale region of Hamilton, the proportion of people who are living in low income conditions are vastly higher for people who are living in Riverdale, East and West. So in the proportion of individuals that are ages 0 to 17 that are living in low income circumstances are about 34% for Riverdale East and 14% for Riverdale West. And when we look at Westdale, which is a bit more affluent, it's 3% for that neighborhood. And so when we also look at the income for those neighborhoods in a comparative fashion, in 2015, the incomes in Westdale were significantly higher at about $110,000 per year for families, in comparison to Riverdale East, which was about $48,000 for the year, and Riverdale West, which was $70,000 for the year. And another disparity that's evident in Riverdale is around housing. So data from the census showed that of the individuals rating the suitability of their specific household, in Riverdale East, 18%, and in Riverdale West, 8% of those surveyed found that their dwellings were unsuitable. And when we compare that to Westdale, there was only 4% of people in Westdale that found their dwellings to be unsuitable. So, it's important for us to think about these factors, of course, the social determinants of health, housing, access to obviously, good incomes, et cetera. All of these have impacts on people's health and their health status. So it's really, unfortunately, an area that is ripe for a lot of disparities due to all of these factors and all of these contexts. And so that's really where the SCORE intervention situates itself in and grounds itself in the fact of the existence of these disparities and the communities that are living in Riverdale. So as I said, I joined this project back in February. SCORE is short for Strengthening Community Roots Among Newcomers in Wellness and Sustainability. And one of the core aims of the SCORE intervention is to promote healthy, active living, and that is being advanced through a number of different endeavors, which include connecting to nature, facilitating people to develop a nurturing or a love of nature, and establishing healthier habits in their childhood through stronger connections to the natural environment. It's also focused on family-centric, nature-based interventions. So, of course, including the family is far more powerful than including just children or just the parents. When we're involving parents and children, extended family, we can really create an environment of support where, families are going out, hopefully, and engaging with nature and being in nature and going out and getting involved in an active and healthy lifestyle. Also, social prescribing, so linking people with sources of support that are within the community that will help them to improve their health and well-being. And Russ, we can move on to the next slide. So some of the intervention aims, of course, have been targeting behavioral risk factors. So, focusing on unhealthy eating and physical inactivity. We know that both of those factors are very high risk factors that can lead to obesity, chronic illnesses, chronic diseases, and deleterious conditions later on in life. And the ultimate goal of the project is really to enable long-term healthy active behaviors throughout the life course and to reduce negative outcomes related to cardiovascular health. So there are several project activities. I think that and you can see the list there, but I think that the one that is obviously the most important to our discussion today is our systems map. And so we can move to the next slide, Russ. A systems map, if you have not heard of it, I thought it was important that we could all be oriented towards what it is and what the function of it is. So a systems map really is for lack of a better term, a map that shows the components and boundaries of a particular system at a specific point in time. And the system can be whatever you are approaching or whatever you're interested in. So if it's the mental health care system, then that systems map would be focused on that. If it's the healthcare system, hospitals, the system map could be focused on that, and community health systems. If you're in our circumstance, we're interested in healthy active living. So our systems map is a little bit different in terms of the prescribed system, but it does seek to map out the boundaries of the city of Hamilton and particular and specific healthy active living sites across the city. And so a systems map should be understood as being a representation of our collective understanding of why a system behaves in a particular way and how it behaves in that way. And then it can enable us to learn what points of intervention there are so that we can potentially intervene in the system if we're seeing that there are disparities or there are potential risk factors or there are inequities that exist. So the main use and function of the systems map is to help structure a system and, of course, to communicate that structure and communicate those results to people, whether those are people who are working, within the system, or people who are working adjacent to the system, or people who are simply engaging with the system as users. So, systems map can be powerful for people who are service providers, but it can also be powerful for people who are living in communities and who are looking for supports, whether those are supports for healthy active living or mental health care supports. And most importantly, and I think this is something that we've discussed several times as we've been designing the systems map. The systems map is not a static entity, it's a living map. So the system is not, and that's because the system itself is not a static entity. The system changes, it moves. Services become, funded and defunded. They move to different parts of the city or different parts of the province. And so a systems map necessarily must mirror that. And so, one of the challenges, of course, of systems mapping is that sometimes the system, even though it seems that it moves slowly to us, there are rapid movements within a system that need to be taken account of and need to be represented or re-represented onto a systems map. Okay, so that is it for my section of the presentation. I'll hand over the rest of it to Natasha.
Thank you. So like Fatimah said, a systems map is living. So in our case as well, it is interactive. So the map that we will be creating and displaying is going to be an interactive map that the community can engage with. And so there will be several features on this map that are customizable and I guess adapted to the community's needs in particular. And so because of those reasons, we needed to use a software that was flexible and that was equipped to all of those needs. And so that's why we went with using ArcGIS Online for building our beta map. And so ArcGIS is a digital geographic information system that is used to create and build maps. And so the advantage of this software as well is that you are able to build these maps with base maps and layers and make a very personalized map. And so after surveying the community's needs, we're able to go back in an iterative way to replace things and make edits and customizations. And so two of the reasons why we went with this software as well is because it's forward facing in the sense that it's fully equipped to share on social media and web pages. And so once we have fully completed our map, we are set and ready to go with sharing it with the community, and it just makes it accessible. And a second point that was very important was that it's equipped to track analytics. And so we'll be able to see how users engage with this map. And there will also be a forum for feedback where users will be able to communicate any issues with the map that they're experiencing. And so in this sense, it's very equipped to be user-friendly and to constantly incorporate feedback at several points of the process. And so we can go to the next slide. Perfect. And so like I said, the systems map is comprised of base maps and layers. And so here's a list of the base maps and layers that are implemented in our specific systems map, which I will show you in just a moment. But how we came to decide these base maps and layers was in a twofold process. And so first, our systems map working group had discussions and brainstorming sessions to kind of discuss our interpretation of the literature and what we thought is important for this map based on our understanding of the community as well. And so as we had identified this community to be newcomers, low income, we wanted to make sure that we were implementing and depicting areas that could service those needs just from the get-go. And then from there, we also had observational activities that were in addition to this kind of literature review. And so these observational activities in the community, such as the gallery walk that took place at the elementary school in the community, gave us more insight to the values and interests of the youth. And so once we understood that, we were able to depict more areas that were valuable to this community on this map in particular. And so here you see so key community areas, and so that was the Lake Avenue Public School in particular, and the community center that's located beside the school. And so in our time in the school during this gallery walk, the kids communicated very clearly that they love playing around the school during school time, but also outside of the school time, just because of the green space that was there. And so that gave us insight to the fact that they just liked playing in green space. They wanted open green area, green fields to play soccer, to play tag. And so that gave us insight to implementing and depicting the parks and park amenities on the maps as well. And so this kind of goes back to why we had to use ArcGIS, is because as we constantly receive feedback, we needed to be able to go back into the map and add these layers. And so that flexibility was very important. And so we can move on to the next slide, which I do think is actually me sharing the map. So I'm going to share my screen here just so that we can all get a better idea of what these base maps and layers look like once they're actually all aggregated together. Okay. And so here we have our preliminary map. And so this was kind of what we were able to establish in our systems map working group meetings. So here we decided what our parameters would be, and it was the entire city of Hamilton. We didn't want to just limit the map to the Riverdale area because we recognized that community or families may be accessing services outside of their immediate neighborhood. And so we wanted to make sure that we were encapsulating activities and services throughout the entire city to allow people that option to access different programs. And so here on this map, we have the Lake Avenue Public School and the Dominic Agostino Riverdale Community Center both depicted here. And so these were our key areas that we focused the map around. And then within our meetings as well, we had identified our key partners who we would be working with throughout this project. And so these key partners are also identified in this kind of preliminary map that we had established. So the YMCA Immigrant Services, here we have Hamilton Public Health. We have the City of Hamilton as well as several other immigrant services, all located within the wardship over here. And so after we had identified this kind of preliminary base map, we moved into putting in the layers such as the green spaces and the park amenities that were kind of identified through highlighting the youth's values. And so here you can see that the green spaces are identified with like this highlighted green, and then these red dots here depict the park amenities. And so community members accessing the map can see what services are offered in the park. So they can see whether soccer equipment, soccer fields are there, whether basketball, baseball, is offered in that area. And then also we have tennis courts and waterfalls all depicted here as well. And so in addition to kind of like these park amenities and services and activities we had identified, we had worked alongside local partner Friendly Streets, who had actually built a map that they had used for their organization that was basically highlighting and depicting safe walking trails and spaces, which was very important because the kids in the community had actually communicated that a barrier to outdoor play was safety. So their parents didn't want to allow them to go outside because there was a concern of safety and safe spaces to play. And so with this map that Friendly Streets had actually sent over to us, we were able to depict more specific safety guidelines on our map as well that are specific to the Riverdale neighborhood and the Hamilton city in general. And so here I can show you across certain intersections, there are notes that basically highlight what streets are the busiest and if there are any concerns in the area. And so this is something that specifically services a need that we were able to identify in the community. And so finally here, this is our completed beta map, and this is what it looks like fully zoomed out. And so this is all of our base maps and our layers aggregated together. So here you see beaches depicted, the schools are on here. And so from afar, a little bit harder to navigate, but this is why we wanted it to be an interactive map rather than static, is we wanted the community to be able to move around and to pick the areas that they wanted to be in and the areas that they wanted to locate services and activities in as well. And so this is kind of how we've left our completed beta map. And this is based off of the observational activities and the review of literature and system map working group discussions. And so I will stop sharing my screen now. We can go back to the slides.
Sorry, just bear with me for a sec, Natasha. I'm just have to load it up again.
No problem. Perfect, thank you. And so the creation of that beta map is kind of the first step of the systems map completed. And so now that we have that beta map, we're moving into our stakeholder interviews, which are intended to gain a deeper understanding of the community's needs and their engagement with existing services in the Riverdale area. And so, like I said earlier, this is an iterative process. So we're constantly going back and incorporating information as it becomes available to us. And so the purpose of these stakeholder interviews is to see if the services that are available are equipped to the community's needs and to basically identify any gaps that are existing. And so with these interviews, we're aiming to interview 20 community leaders or program coordinators who would be able to discuss the capacity of their organization and describe the user engagement with the existing activities that their organization offers. And so the way that we plan to recruit these community leaders is through our expert community partner who will identify potential participants, and we will proceed with snowball sampling, referrals, and convenience sampling. And then just onto the next slide, we can talk about the objectives of these interviews as well. So the three main objectives in order is first to characterize the user engagement of the programs. So like I said, we want to understand what these programs are offering, and we want to know if the resources available are enough to service the community and fit their needs. And so like we said, the purpose of SCORE is to promote healthy, active living within this community. And so we need to basically first assess whether the existing services whether the existing services is helping the community in the capacity that it needs to before we're able to implement interventions that can assist further. And so the second objective of these interviews is to determine if there are any barriers and facilitators that are affecting accessibility to these services. And so barriers could look like the cost of programs, the time that services and activities are offered. On the other side, facilitators could look like carpool services or promotional offers. And so we want to see if there are any barriers and facilitators that could be affecting the user engagement in particular. And then finally, the third objective is to improve the functionality of the systems map. And so with these stakeholder interviews, the goal is to have these community leaders or coordinators take a look at the map and assess whether their organization is being accurately depicted on this map. This will give us greater insight into whether the data that we're using is up to date and whether it is reflecting the community's needs. And it will also allow us to see whether there are any changes we need to make before we show this map to the community. And then we can perfect, thank you. And so our avenues for feedback are, again, iterative, but we have three main avenues where we are receiving continuous feedback about this map. And so one will be the Community Advisory Board once it has been formed. And so this board will be comprised of community partners and members who will be able to give feedback on this map and be able to share whether it is adequate enough. And so with this insight, we'll be able to see whether further updates need to be made as we make these big changes as well. And then another opportunity, which I think is honestly the greatest out of all of these, are the community events that are offered throughout the summer, particularly the ones that are run by the YMCA. And so these community events allow us to interact with the residents of Riverdale in particular and engage with them in an informal way to kind of discuss their thoughts and opinions about the map. And so once we show them this map, in the at these events, we're able to have these very casual conversations about it. And I think that that type of feedback is very helpful because it allows the community members to, one, get involved in the project and first kind of realize that their feedback is very important to us. And two, it allows us to see basically if what we're doing is useful at all before we kind of make these big changes and have it fully up on the website. And so the first community event that we will be showing this map at will be the Friendly Streets Facilitated Walk next Thursday on July 14th. And so following the community's outdoor walk, they will be invited to take a look at the systems map, and they will be able to take a preview, and they'll be able to scroll through and interact with the map fully as if it were up on a website and kind of give their feedback to what works for them and what doesn't. And the great thing about this opportunity is they'll be taking a look at the map, kind of previewing the exact route that they just walked. So this facilitated walk is through a trail in the Hamilton area. And so they'll be able to kind of see if the map is accurately depicting what they saw on the trail. So the trails, the bike racks, the park amenities. And so that will be a great opportunity for feedback as well. And then finally, our SCORE operational meetings are utilized to kind of see if there are any functionality improvements that can be made from an academic perspective as well. And so here we have our short-term systems map timeline. And so we began our brainstorming and literature review in May, and we have now completed our beta map early July. And so our next step is to begin our stakeholder interviews, hopefully within August. And we are hoping to have that done by the end of the year. But we will also be having our feedback from the Community Advisory Board within the fall. And so our next points of focus are the stakeholder interviews and the feedback from the Community Advisory Board. And focusing on those, we'll be able to develop the map further and hopefully also gain some great feedback to what services the community in the summer and also as they transition into the school year as well. And so that concludes our presentation about the systems map for SCORE. We do invite any questions and feedback about our map or about the presentation. And thank you everyone for listening and attending.
Right, thanks. Thanks very much. I will just try and stop sharing here. It's weird. Oh, stop presenting. Here we are. Okay. Great. Thanks very much, Natasha and Fatimah. That was very informative. I just want to start off with one question, then we can open it up to everyone. I was just curious, on one of your maps, you had those comments about the intersection being too scary to play at and lots of traffic. How did you populate those types of fields?
So those fields were populated by the Friendly Streets organization. So they did research that basically took a look into safety of certain intersections in the Hamilton area. And then also they had data from the city of Hamilton as well that they were able to incorporate in the map. And so as they're one of our local partners, they had agreed to share this map with us for the purposes of incorporating it in the systems map to share with the Riverdale community to specifically share those areas of concern.
And I guess, is there a mechanism set up where some of the other aspects that you've captured on the map, we can annotate those with comments in a similar way? Like, you know, basketball courts, for example, these ones have potholes in them, or these tennis courts, the nets aren't up.
Yes, exactly. So
Okay,
as we go, specific comments can be made under those points that have been identified on the map. So we can
okay,
kind of elucidate more specifics if they're necessary.
right. Thanks. Jellock, you have a question? Thanks.
Yeah, like I found this map, it is so interesting, and I think like this map can be like very useful for anyone who is coming new to this country. And I was thinking like it is not only applicable for the children, but it could be like very useful for the international students who are coming to this country, and then they can identify like where they can go to play something, or is there any community or anything. Like I found it is very interesting. So I have like one question, like how you actually define the safe road or like safe walking thing. Is there any definition for it? Or how actually you define it?
So I'm not sure that there's no kind of firm definition for what was safe. Here it was kind of in this particular map, it's kind of a compilation of several forums that Friendly Streets have used to kind of identify what is busy and what is an area of concern. And so some of the forums are from the city of Hamilton in particular, but also I know that they had a specific field where they kind of allowed the community to reach out to them and identify what areas and what intersections were busy. And so they would note that down and then depict it on their own personal or their own organization's map. And so once all of that was compiled together, they sent us that map, and then that is how we were able to depict those areas on ours.
Yeah, very interesting. Yeah, it makes sense. Thank you. Thank you.
Of course. Thank you for your question.
Okay, Lisa.
Oh, kia ora. So thank you so much for sharing that presentation. I had a few queries. Like, is there scope with the systems map for the community to populate information in it themselves?
So once oh, sorry, you can go ahead.
No, go ahead.
So once the systems map has been further developed, there will be a field where community members can search like particular fields if they wanted, so they can look up like specific services or activities. So in that sense, that will be made available to them. That's not currently available in our beta map, though.
Cool. And my second just not really follow-up question related, is these, digital tools are a great idea, and communities often say they like digital tools, but getting them to engage is something that can be quite challenging. And I'm just wondering what thought or what investigations you've done looking at how you get that community engagement with the tool.
Sorry.
You can go ahead.
My phone is on mute, so it takes me a while to get it unmute. But I think, this is definitely something that we have been talking about on the SCORE team, in terms of like getting feedback from people about the utility of the map. So we can obviously build something, and the idea is for the map to be useful and used by community members. The main target is not, academics. And so I think that when in our Gantt chart, in our timelines of the systems map, we have various opportunities where we're doing engagement and getting feedback from community about the systems map, where we're seeing if people find it useful, what they might change, what they may find interesting or less interesting, and that will help us to continue to refine the map. Of course, at the end of the map, at the end of the development of the map, we don't know if that will that information will guarantee us that people will take up the map. But we are looking to hopefully partner with, or thinking about partnerships that we can go into with, like, the city of Hamilton or the libraries, entities that have greater relationships and pull with community members who can potentially maintain the map, and then also keep the utility of the map going and keep the map on people's minds and bring up the map to people who it may be useful for. So, it's not, on the back end, of course, we can do everything, or we're looking to do everything that we can to ensure that the map is engaged with and that it's refined and shaped by community perceptions and opinions as much as possible. And then I think it's going to take further creative approaches to make sure that the map is, taken up and used by community.
Thank you.
And sorry, I just have a follow-up question, I guess, to Natasha, and I guess to anyone else on the call who has experience with community maps and implementing them. Fatimah, in your experience doing them with the Black community, were they used after they were developed and put out there? And how did people engage with them?
Yeah, so I mean, the map that we developed it's a project called Pathways to Care. It is used, and we use Google Analytics to determine people's, because the map is housed on our website, which is pathwaystocare.ca, and it's on its own webpage. And we have definitely been able to monitor clicks and time spent on the map page. We also recently created like a tool called Connect Me that's kind of like an aid to the map, and it uses filters for people to determine what's most important to them, whether it's free or low cost mental health care services, different languages they may need it in, age group, etc. And so that is another tool that we've implemented and put onto its own page that we also monitor, that allows people to use our tools. And so if you are using the map and you're realizing, okay, there's these services in my neighborhood, but then I want something more specific, then you're able to go to Connect Me. So they're kind of used, we built it so that people would use it in tandem, and we built Connect Me because we were hearing from people that they wanted something that was like a secondary kind of level. What we've also been hearing from people that use those maps is that they also want kind of another extra added layer of the map that tells them whether or not services are actually accepting new clients. And so, that's been a really iterative process where we've been able to get feedback from the public, from our evaluators, from, our community advisory groups and our youth advisory committees about our map and about the utility of the map. So, it's being used and it is utilized, but we are also always doing promotion of our map on our social media channels, sharing it when we have opportunities to talk to, papers or, media. So it's a constant and it's a consistent engagement that really makes the map, I think, utilized.
Thank you. Lisa, I think you're muted, perhaps.
Oh, yeah, no, I hadn't. I just had another question with no one else asking one. I guess you have to sort of be careful, don't you, that that you don't put too much information about where children might want to hang out alone, or because other people might find these tools useful for nefarious reasons as well. So sort of it just struck me that it could be a handy tool for people that we don't want them to use as well. We don't want to use them.
That's a really good point, of course. And you know, the reality also is that these the map is going to map out like where these places are and the safety of certain streets and you know where basketball courts, etc. are. But you know, there are other maps that also exist that show parks and that show schools and show other places that children and families may gather. And it's not a map that's for children alone. SCORE is a project that's for families. It integrates families into the equation as well. So that's not to say that parents would always be with children when they're in these spaces. But it is a really good point. And I mean, even when we're designing our map and our the work that we've been doing with population care, we always create like a disclaimer when you first visit the website that if you're experiencing, you know, a mental health crisis, please call 911 because we're not a direct service provision or emergency service provision. So, I mean, the same thing could be helpful on a website that the Friendly Streets, I'm sorry, not the Friendly Streets, the SCORE Project Systems Map is housed on that, you know, disclaimer that, you know, it's important for, you know, children to be accompanied and supervised in these spaces and that, you know, just because they're mapped doesn't mean that there's supervision that exists there. So that's a really good point.
Sorry, and probably rather straightforward question. Is the plan to develop it both as a mobile app as well as a website? Or is that now just commonplace and I'm just old?
Yeah, no, not commonplace, but I would say yes. The goal is to have both, for accessibility reasons. Having it on a web page is great, but you know, like from a phone, it's not always fully accessible. So having it on an app is definitely something that we're going to work towards as well, just to make sure that it can just be accessed from multiple avenues.
Yeah, and I was just thinking about today with all of our tech issues, so some of us would have to use our networks. And also, again, I know it's early stages and I haven't been super involved in this planning part, but you know, what about multiple languages? So right now we're offering it in English, but you're saying we're offering it to sort of a new settler community. Would we have the ability to translate this into different languages?
Yes, yes. So we would, and that's something we have considered. So in this particular community, Arabic is actually the most most common language spoken. So we have identified that we will need to have this map translated into Arabic, but also Farsi and Punjab have also been identified as languages that we will have to have translations available for, just so that we can make sure that we're allowing as many people as possible to interact with this map. And so whether that will be fully translated versions of the map or just a translated legend, I'm not fully sure yet, but I think in terms of kind of viability, I think it'll just be translated legends that will be made available all on the same web page, and then we can toggle between languages.
Great. Okay, well, I don't see any additional hands. So I will just take a moment to say thanks to Natasha and Fatimah for your presentation and your work so far, and we look forward to working with you and the whole Systems Maps team on bringing this forward. So thanks so much for the work you've done so far and for showing us where we've gone to date.
Thanks so much, Russ, and thanks again for all of the technical help. And thank you, Natasha, for the work that you've done on this this presentation as well. And thank you to the audience for coming in the midst of a systems-wide outage. I don't even know what to call it, but thanks for being
time.
That's great. All right. Thank you, everyone. Have a wonderful weekend. Thanks for coming from wherever you all may be and for braving up tech difficulties. Okay. Bye-bye.
Thank you. Great. Thanks, Russ.
Thank you.